You calling from New Jersey? Who's this?
Oh, hi. Am I on the air?
Yeah. Who's this?
All right. How's it going, Sam? It's Daniel from Trenton.
Hey, Daniel.
I just want to, because I saw a couple of your YouTube videos talking to some libertarians, and they sound a little nutty, but I guess there's notes in every political spectrum. But I kind of want to represent, libertarians who kind of more cost-benefit, understand there is a role for government, but basically are just fiscally conservative, socially liberal.
Okay. So what do you think the role for government is?
I think government does have a role. In say like regulation, like the EPA. I think even though I do think EPA has gone perhaps maybe more micromanaging in the past decade or two, but I do think there's a need for an EPA. I think even Gary Johnson said, I'm not going to shut down the EPA. I think we need it. I think there is a role, but just needs to be, more simple and, not catering to, big business or whatever.
Well, yeah. I mean, I think, in fact, their regulation should be stronger in some respects. So tell me what it is that, where would you and I disagree then?
Well, for example, how big do you think government should be? How much, do you think they should spend more than they are now? Do you think, they're about 40% of the economy when you include state and local. How big do you think it should be?
Well, I think that government should be spending close to about, I don't know, I don't have a specific number per se, but I have no problem with government spending 24% of GDP if they're spending that money wisely. I think it's actually silly. I think it's actually a silly question. How big should government be? It should be as big as it takes to do what people want.
So do you think there's any wasteful spending now that you would cut out, say military, foreign aid, bureaucracies?
Well, I can tell you foreign aid represents maybe less than 1% of our budget.
Yeah, I understand that.
So would I cut out military spending? Of course, definitely.
Okay.
I think we could, close to half our military budget and see absolutely no implications in terms of national security. I mean, I understand there is an argument by some that there is some notion out there that if we have 2 times the military budget of the rest of the world combined, then what we are doing is in some way discouraging other people from growing their military budgets because it's impossible to catch up with this. I'm not sure I buy into that, but we have 800 bases around the world. There's absolutely no reason for it. I would much rather have.
Yeah.
Yes, as a liberal, I don't have any. I don't have any problem at all with massive cuts to the defense budget. Not at all. In fact, but the difference is I would like to see that money, I would like to see that budget cut, and then I would like to see it put into government programs. I would like to see universal health care, which would probably end up saving us money, but I would like to see very robust universal health care. I think more infrastructure spending. I would like to see mass transit expanded greatly. I'd like to see more direct funding of broadband across the country. I would like to see better urban planning.
All right. Well, we agree on military spending. Even I think you have the liberals and even the hardest core libertarians take the same stance. But you want. I agree that we would spend less if we had universal health care. Spending would be less, but I disagree on the approach. I do think there is a role for government, some role in the.
Well, how do you think we get universal health care? What about the approach do you disagree with?
I think Singapore has a decent model. I would change some things, but they have something called MediSafe, where they take. See, this might disqualify me from being a libertarian, but it's a mandatory savings account, 6 to 8% of your income, I think, and I'm not sure if the employer matches, but basically everyone has a medical savings account. It's a little bit of personal responsibility. There is, I think, some sort of safety net where if you're really poor, I'm not sure how it works, but they have Medicaid. They do have insurance, and it's like an option that I think the government provides. I would privatize that part, but there people usually don't use it. I think because of cultural reasons, because they'd rather turn to their family. But I think it's more of the healthcare cost problems. I don't think just eliminating the state lines is the whole fix the problem, which Republicans want. That's one step, and tort reform. But I think it's third-party
Well, first
payment.
off, wait.
You know, because
Tort reform's a joke. First of all, that's a joke. There's no documentation anywhere other than by insurance companies where you'll see any argument that tort reform is going to save any money. I mean, I think Texas or California, you can already see that. But a mandatory savings account by the government is, I mean, it seems to me it's just a question of semantics at that point. I mean, and you there?
Well, I mean, yeah, I don't get how it's more to eliminate the third-party payment. You pay into an insurance pool, and, you know, it's basically the idea that no one spends money more carefully than someone spends their own. Ongoing needs, something like over 95% of
But isn't that managed by,
non-emergent.
it's managed by the government?
No,
In Singapore, it's managed by the government.
Account. You just can. It's your own account, though. But the savings account part is your own. The government makes
just like your
put
Social
in a
Security
certain amount.
is your own account.
No. Because Social Security is more redistributive. Where there's like a. This is you're putting your own money into an account. The government's just making sure you do it. So it's like having a savings account that you can't pull out for anything besides, say a doctor's appointment or something.
Well, what you're describing is the Affordable Care Act.
Private medical savings accounts is not the Affordable Care Act.
I got news for you.
Medicaid.
Yeah, I got news for you. It is when you look at the subsidies and you look at price controls, it is very similar to the Affordable Care Act. And in Singapore, it's delivered through the Ministry of Health.
I don't think that medical savings account. I mean, Singapore doesn't let you pay your insurance for things like doctor's appointments and ongoing needs that you have to pay out of your Medicaid. There's big co-payments and hospital fees. It's completely different when you have to pay. It's your own money you're using, and they don't have to worry about insurance companies for doctor's appointments and things like that.
So you're just saying catastrophic, mandated government catastrophic health insurance.
I wouldn't have the. I would do mandatory savings accounts. You could pay out of that for catastrophic emergency insurance, which would be privatized. I would let I'd phase it out and let the people have their insurance program, their insurance, whatever.
All right. Well, so we have a slight difference. I mean, I don't know that this is ideological per se. We have a policy mechanism debate that you're talking about a different model. But I mean, the Affordable Care Act is essentially in the same neighborhood where you are. It maintains the private industry. It mandates that people have insurance. In this case, in Singapore, it mandates you have a health savings account, presumably to buy health care. In Singapore, they offer subsidies and price controls. In the Affordable Care Act, they offer subsidies and price controls. For me, it doesn't go far enough. I don't think...
Well, no.
I mean,
Singapore
is arguably to the left of the Affordable Care Act.
The point of the medical savings account, so it addresses the third-party payment. You're using market forces to determine the price of things. With insurance companies, I mean, no one knows. I don't know how much it goes to do blood work or go for a doctor's appointment. I don't know how much it costs. Probably $200-something. Probably shouldn't cost that much. It probably costs $50 to $100.
Right now.
Well, there's no competition.
Now, let me ask you this.
All right,
let me ask you this. Why is it? Can you explain to me why it is? And I'm not talking administrative costs. Everybody knows that Medicare is far cheaper to administer by the tune of about 25 cents on the dollar than private insurance. But that's obviously because they have no profit motive and they don't have the same sort of marketing expenses. They don't have the shareholder profits. All right, put that aside. The growth of cost of medicine under Medicare is slower than the growth of cost of medicine in the private insurance industry. Can you explain that to me?
Well,
If market forces,
the growth of the cost.
if market forces are meant to decrease costs in medicine, why is it not working in this country?
Because so the medicine costs are going up slow under Medicare, under private care.
That's correct.
I didn't. I don't know. We're not paying. I mean, that I don't know. I would say this: if you have, if you go to a doctor and you're paying for it out of your account.
No,
I
I understand the theory behind health savings accounts is that I'm going to shop around for the doctor. But like you just said, you and I not only don't know what a blood test should cost, we don't even know if we should have one. I mean, I got a pain in my ass right now. Literally, I'm not being facetious. And I don't know what it is. And I'm going to go to the doctor, and the doctor could say to me, you got kidney stones, or you just got a cramp. You need to go in for more tests, or you just got to go home and put some Bengay on it or something. I don't know. This is not like me buying a stereo and going like, you know, even back in the day when you would buy a stereo when they had them, I'm old enough to remember you go into Tweeter, you know, whatever it was, Tweeter, etc., when that was actually a stereo place. The guys would try and sell you stuff. But I can go and I can listen to a stereo. I can say, that sounds okay for me. I'm going to buy that one. But the idea that patients are consumers and can actually be educated consumers is completely ridiculous. I mean, yes, if I have a catastrophic disease, if I have cancer, I'm going to dedicate a lot more time to learning about cancer. But I can't diagnose myself. I can't tell whether or not this doctor. I mean, the idea is that we're supposed to trust these doctors, and the reason why Medicare, the rate of medicine essentially is growing slower than under private insurance is because they do more best practices. It's just that they have they not only buy in bulk, but they also do best practices. In the Affordable Care Act, one of the things that they're putting in, one of the better things is, you know, comparative studies. Is to actually say we're going to fund things that are efficient, not versus doing nothing, but against other medical services. I mean, so the argument that you're making, the fact is that the private market, the so-called free market, to the extent that there is one in medicine, doesn't keep down costs. There's a reason why all the industrialized Western countries pay a fraction of what our government, never mind what we as per capita pay for health coverage and health care. And that's not because they're all depending on the free market. It's all because they have far more socialized systems of medicine delivery than we do. That's just a fact.
No, I know they pay. Well, our healthcare system is a disaster. I mean,
yes, but I mean, do you not see any correlation between the fact that we pay double what everybody else pays for medicine? And by medicine, I mean all medical services.
I'm not defending the current system at all. But the current system. I mean, for example, like for almost anything, like I don't know how to buy a car. I don't know, you know. I mean, like I don't get insurance for food or something. That just the third party payment is one of the huge issues in that. Like they're all. I mean, like for example, if I'm not, you know, if I have the sniffles or something, and I know it costs $100 to go to the doctor, and I've had the sniffles 3 times before, I'm not going to go run to the doctor. You know, right. I mean,
what if you have, let's say, an infected tooth? What if your tooth is hurting, and you don't have that $100 to go in to see the dentist, and you're just hoping that maybe I can treat it with Oragel for $5 over the counter? And I use that example only because there was a story of a young kid whose mother made that decision because she didn't have the money, and the kid died. Now, I'm sure there's more stories like that. What if this pain in my ass is in fact a kidney stone, or what if it's kidney cancer, and I decide I'm not going to go in because I don't want to pay the copay. I'm going to be a smart consumer. I've had asses in my pain in my asses before. I'm not going to do it. I mean, at what point
Okay, well, that's what
does a
there
guy
has
who
to
doesn't
be
know anything
some
about medicine
personal-
say it's time for me to go into the doctor?
There has to be some personal responsibility. Again, the MediSave account, if you're putting in, even if you're making
Why?
not
Why
that
does
much
there have
money,
to be?
8%
Why
of-
does there have to be a personal responsibility to be able to diagnose yourself as a doctor who goes to school for 8 years? What? Why?
I'm talking about for minor things.
Well, we don't know what is minor or not. Tell me
What
why.
about checkups? See,
Tell me why.
why what?
Yeah, you say there has to be personal responsibility for that. Why?
Some personal responsibility.
Why?
All right, for example.
I'm just supposed to accept that principle? Why?
People go for, why what? Why
You're
personal
telling me that
responsibility?
morally, people have a responsibility to know whether or not they have a serious ailment or a non-serious ailment. And I want to know where you get the justification for that morality. I mean, if I have no options,
I'm talking about.
if I have no options, then I have no options. But I mean, we live in a civilized, theoretically evolved society. Why should that be a moral tenet? That I have a personal responsibility to know whether or not my ailment is minor or significant and could be worse in the future if I don't go to the doctor. Why should that be a moral tenet?
Moral tenet. Well, here's why. You go, for example, for checkups. Just say people go for checkups every year. Maybe they don't need to go for a checkup every year. Maybe it's once every 2 years. Maybe it's once every 3 years, depending on how
Why
healthy
is it
they
their
are.
personal
If people are
responsibility
responsible for
to know
themselves,
this?
They won't. Maybe they'll decide not to smoke. Maybe they'll decide not to drink as much. Maybe they'll decide not to eat as much because they don't know what it'll take away from their medical savings account. If they're sick, go to the doctor. We can say, all right, if you're not sure, go to the doctor. Go ahead, but take some responsibility. Where should I smoke or should I not? Is the government going to pay for my cancer if I have lung cancer to try and heal me? Or am I going to have to bear some of that cost? Why should I have to pay if someone's going to eat Big Macs every day?
Dude, we have that right now, don't we? No, wait, hold on. We have that right now. If you're a smoker, your health insurance goes up.
No, I know. I'm not. Yeah, exactly. Yeah, I don't like the system.
But that's
I'm
the
not
private
defending
market.
the system.
It's the private market.
What's that?
It's the private market.
No, if you have to go for liposuction, I'm not sure. I don't think insurance pays for liposuction, do they?
I have no idea.
Well, anyway, would you have universal health care pay for liposuction?
Would I? No, not unless it was medically necessary.
Okay, and okay, someone eats.
Do you know what universal health care? Do you know what single payer health care would provide? Do you know what it is? Do you know what I'm talking about?
Well, it's similar to the Canadian system, right? Medicare for all, right?
Yeah, Medicare for all. It's health insurance that is just simply administered by the government. It's just bought in bulk. What's problematic with that?
Well, because we see what we do within government is you can either government cannot just do things more efficiently. It either will have to pay the full cost, say 15, 18, 20% of GDP, or it will just choose not to pay them, and you will see rationing in some areas of care.
We already see rationing in care. That's what it's called. It's called health insurance. Private health insurance rations cares all the time. You go in for certain procedures, the health insurance company says we're not going to pay for that. See rationing of care all the time.
Well, depending on
your
on
health service account would ration care, wouldn't it? You're talking about rationing of care because you only get so much from your health savings account. Everything's rationed.
Well, again, the individual chooses what's rationed and not the government. You want the government to decide what's an elective surgery.
Hey, you know what? I want a panel of experts, of doctors who are going to tell me whether or not the care that I'm getting from my doctor is legitimate. That's what I want.
Okay, so you don't trust your doctor, like you were saying before. You don't trust your doctor before about
well, I trust my doctor because I'll tell you why I trust my doctor.
I tell you what. Trust your own doctor.
I'll tell you why I trust my doctor. I trust my doctor because I am surrounded by very wealthy people and I have relatives who are doctors. And I live in New York City. And I have all of these cues around me to allow me to trust my doctor. Now, my insurance company, they don't necessarily trust my doctor because they don't pay for everything that my doctor says that I need. They're rationing my care. But I certainly, if I was living back in Worcester, I might be interested in having some outside confirmation that my doctor is using the most effective forms of medicine. And I'll tell you something, having gone through childbirth, I haven't gone through childbirth with my wife. I also understand that, doctors are not infallible. And there's a little bit more at risk here than whether or not my tweeter or my hoofer or whatever the hell it is on my speaker is going to deliver the bass I want it to, the woofer. The point is that patients are not consumers. And to reduce them to consumers is not only, I think, bad for people's health, I think it's also really bad for society. But let's continue this another day because I've got to jump.
All right.
I appreciate your calling in. Call in anytime.